my name is Joshua Rue, and we are back again with my patient Caitlin, and today we are doing the cardiac, peripheral vascular, and abdomen health assessments. So starting off today, we're going to start out with the cardiac system, and I'm going to start out by looking for some basic landmarks. So first, I'm going to look for the suprasternal notch, and that should be right here just above the sternum where the two clavicles meet. Then I'm going to go down, and right around this area I can feel the angle of Lewis, which is the bottom of the top of the sternum, and afterwards there is a slight depression going down. So then at the angle of Lewis I just go straight across. That should lead me to the second rib, and below that the second intercostal space. So in the next part of my assessment, I will move on to the inspection, and through all areas of inspection, I'll be looking for cusp, color, ulcerations, scars, pitting edema, and swelling. So starting off, I'm actually going to have you lay down.
Like that, I guess.
Actually, I'm sorry, if you could lay down on the other way, I'm sorry about that.
Okay.
All right, so starting off, I'm going to look at her jugular vascularity dilation, just to see if there should be a little bit of a pulsation, but it shouldn't be too obvious. It shouldn't look like it's working itself too hard. All right, and it's looking good. So for the next portion, I am going to do the hepatojugular reflex, in which I'm going to push down on the liver, right about here. And yeah, I can see, looks like her jugular is pumping blood. It should be between 1 to 3 inches. Anything more than that, we have a slight issue, but it's looking good there. It's responding the way it should. All right, and next I'm going to look on her left side there, around the fourth intercostal space near the heart, and look to see if I can see any abnormal pulsation. Normally shouldn't see any, and I don't. All right, and for the next part of the exam, we're going to move into palpation, which I'll be looking for temperature, texture, turgor, and tenderness. All right, if you could sit up for me again. Thank you. All right, first I'm going to start by palpating the apical impulse with my 2 fingers. It should be right around here, the fourth intercostal space. And it's feeling good. All right, next I am going to palpate across the precordium, where we're later going to be auscultating later. I'm going to be feeling for any thrills. So first I'm going to start just below the heart here. And then I'm going to move up like this. And then I'm going to move across over here, since the heart goes that way through the body. All right, and next I'm going to palpate the carotid pulses in her neck. And since I don't want to occlude blood to the brain, I will just do one at a time. All right, I can feel it. And I can feel it there. All right, for the next part of the exam, we will be doing the auscultation. And I'm sorry, we have a little bit of a visitor here. This is Casey. All right, so for the next part of the exam, I will be finding the heart sounds, notably S1 and S2. S1 should be down in the left upper quadrant here near the apex of the heart. And I can hear it. And S2 should be right up here at the base of the heart. and I can hear it. And next I would take the rate and rhythm of the apical area. And then I would put my stethoscope back at the site of S1. And then I would put my finger up here at the carotid artery and make sure that the beat I hear is matching. And it is. Alright, and then I would check the carotid artery for any bruits, which should be any swooshing sounds. And I would use the bell of my stethoscope for that. And I'm not hearing any. Alright, and for one of the final parts of the cardiac health assessment, I will be moving my stethoscope along landmarks of the cardiac system. So starting off, I will be putting my stethoscope and listening to the aortic area, which should be in the upper right. And I can hear it. Then I will move straight across to the pulmonic area at about the apex. I'm sorry, at about the base of the heart. And I can hear it. Then I will move down one intercostal space, listening to Erb's point. And I can hear it. And then I'll move down to feel the tricuspid area. And then I move across to the mitral area. And normally in the clinical setting, I would move the sports bra out of the way, but just for the sake of the video, I'm just going to explain where I would move my stethoscope. Alright, and after having listened to those areas with the diaphragm, I'm going to listen with the bell of the stethoscope. Alright, so again, starting off with the aortic area. Just slightly touching it to the skin. Good. And listening to the pulmonic area. Right, then moving it down one intercostal space to Erb's point. Then down to the tricuspid area. And then to the mitral area. Alright. And all throughout my assessment, especially with the stethoscope, I will be listening for any abnormal heart sounds, any signs of murmurs, or any splitting of S1 or S2. Alright, for the next portion of our health assessment, we'll be moving on to the peripheral vascular system. Alright, I would just start with an overall assessment. I would just have you hold your arms out kind of at heart level, just checking the skin color, making sure it's nice and pink, and it is. Again, checking for cusp, looking for the color, any ulcerations, odd lesions, pitting or swelling. Alright, if you could turn your hands over for me. Alright, looking good. I would take a look at the legs. Again, legs are looking good. No odd signs of any swelling or anything that should not be there. Alright, and for the next part, I will be doing general palpation, just feeling around, making sure. Feeling any tenderness?
Nope.
Alright, I'm not feeling any texture. I would check the turgor of the skin. If you could hold your arm out for me. I would just do a little pinch. And it goes back to where it should. If there's any delay, it could be because of dehydration. And next, I'm going to have you also hold out your finger. And I'm going to pinch down the nail bed. And yep, within 1 to 2 seconds, it goes back to pink as it should. Alright, so next I'm going to feel for arterial pulses, and I'm going to start out at the temporal arteries in the head. And I can feel those are pretty easy to feel. Next I'm going to move to the carotid, also making sure to only do one at a time. Good. Alright. Next I'm going to do the brachial, which should be in the grooves of the elbows. And it should be on the ulnar side of the arm. And this is where you would manually take blood pressure. right, good. And then I'm going to do the radial pulse. And I can feel both of those. All right. And if you could lay down for me again real quick. I'm going to do the femoral area, which should be in the groin area. All right, and I can feel that. And if you could, raise your right knee up for me there, real quick. Just to feel. Oh, sorry. Yeah, that should be good. Feel underneath the knee for the popliteal artery. And I can feel it. All right, and if you can kind of just prop your foot up on the cushion right here. Next, I am going to, actually let me grab the camera real quick. I'm going to feel for the dorsalis pedis, which should be right in between these two toes, right about here. And I can feel it. And finally, I'm going to feel for the posterior tibial. Should be right about here, medial malleus. And I got it. All right, and for the concluding part of the peripheral vascular assessment, I'm going to have you sit back up real quick and hold your hand towards the camera like this, like you're waving towards it. All right, and then I'm going to do the Allen test, and to do that, that is checking for any occlusions in the radial artery, and to do that, I'm going to pinch both the radial and the ulnar arteries. Looks like your hands are a little white. You feel a little numb?
A little bit, yeah.
Yeah, so then I am going to remove my finger from the ulnar artery. And it looks like the color is returning, feeling less numb.
Yep.
Yep. And that is a sign there are no occlusions. All right, and for the final part of our health assessment today, we will be doing the abdomen. So if I could, I'd have you lay down again. Just going to generally inspect the abdomen, and it's looking flat, which is as it should be. I'm not seeing any bulges, any signs of hernia. Looking at the umbilicus, it is about midline, and there's no odd discharge coming out of there. And no odd pulsations. And if I could I have you cough for me? All right, yeah, no odd bulges, no signs of any hernia there. And I would also check for caput medusa, which is an odd, venous, it's an odd outbreak of veins from around the umbilicus, and it usually happens with pregnancy, but obviously you're not pregnant here, so no need to worry about that. All right, and for the, normally I would move on to palpation, but for the abdomen, palpating before auscultating could cause the system to become active, and it could screw up what you hear. So I'm going to start with auscultation. Can I have you sit up for me, please? All right, first I'm going to listen for vowel sounds, and I'm going to start where the large intestine begins in the right lower quadrant. I'm listening for any hyperactivity or hypoactivity. All right, sounds are present. All right, sounds are present. And sounds are present. All right, next I would check for any vascular sounds or any bruits with the bell of my stethoscope. All right, so let's start out the aorta just above the belly button here. All right, and I do not hear any oddities. Then I move on to the renal. And and I do not hear any oddities there. Move on to the iliac.
That could be louder.
No oddities. And then finally the femoral. And no signs of any oddities there. Alright, and for the next portion of the exam, I would move on to percussion. So I would just start by doing a general survey around the quadrants, starting with the small intestine, again using my middle finger, tapping with my pointer finger. Alright. And then I would next try to percuss the liver. Liver will be on the right. It will be on the right side. Then once I can feel it, I will start going down, percussing all the way up. And next, I will be screening for any splenic dullness. There should not be any, as it should not be going below the ribcage. And I'm not hearing signs of any dullness. So then we will move on to the palpation. So I'll start with just some light palpation, about an inch, just around the abdomen. Checking again, feeling any tenderness?
Nope.
No other masses, nothing that should be there. And next, I'll move on to deeper palpation, about between 5 and 8 centimeters.
Close the door.
Apologies, we have some of these together outside. About 5 to 8 centimeters. Any tenderness?
Nope.
Alright, and no odd masses.
I like case.
Apologies again. She has issues with separation. Alright. And then if you could you lay down for me again? Be checking for any muscle tone imbalances, usually, especially diastasis recti, which would be muscle separation here in the middle near the umbilicus. It normally happens with any pregnancy. Good, just together. And there is no sign of any separation there. All right, and then I will be palpating some of the organs, starting with the liver, moving over to the spleen, and then for the kidneys, if you could just lay your arm across your chest. I will be going in the top, going down under, palpating kind of like this, then doing the same on this side. Good. And then I'll be palpating the inguinal nodes in the groin area. It goes horizontal and vertical. Be doing 2 fingers for that. Might take a little bit. All right, and if you could have you sit up for me. Actually, this one I'm going to sit beside you. If you kind of turn away from me on the sofa a bit. Going to be doing the cussovertebral angle, checking for any tenderness. This would be checking for any swelling in the kidneys or nephritis. So I'm just going to put my hand like this and just do a little tap. Any tenderness?
Nope.
Good. Any tenderness?
Nope.
All right, good. All right, and if I could have you lay down for me again. So next we're going to do a test for appendicitis, which is the rebound tenderness or the Blingberg sign. So the appendix is in the lower right quadrant. So we'll start out by palpating on the lower left quadrant, then releasing. Any pain in the lower right quadrant?
Nope.
Good, no sign of appendicitis. All right, next I'm going to check for inspiratory arrest or Murphy sign, and for that I'm going to put my hand near the gallbladder which is right there with the liver. Have you do a deep breath in for me. Any pain or tenderness?
Nope.
All right, good. No sign of anything wrong with the gallbladder. Next, I'm going to do another test for appendicitis. I'm going to have you raise up your right leg and raise it up against pressure. Any tenderness in the lower right corner?
Nope.
All right, that's good. It shows there's no sign of the iliopsoas muscle and no sign of appendicitis. And this concludes the health assessment for today. Thank you.